The relationship between the maxilla and the mandible is, of course, intimate because these are parts of a complex system of the craniofacial skeleton, and they are parts and counterparts to one another. Now, typically, if a child were to present themselves with a deficient mandible, one logical treatment plan would be to bring the maxilla back to represent the dimension and the disposition of the mandible. But the thing is, what's so incredibly interesting about this process and what we explore in the course is that the mandible is employing the maxilla to know where it should be. So if the mandible is deficient, by definition, the problem was with the maxilla, which means the maxilla is deficient. If the mandible is following suit and is deficient, then the origin of its deficiency is actually the maxilla. And to reduce the length of the arch row in the maxilla to compensate is in the opposite direction in relation to the health of the individual. So the mandible, a deficient mandible, is actually telling you something about what's happening in the maxilla, that the maxilla is underdeveloped. And because the mandible and maxilla are in such intimate part and counterpart relationships, if you increase the anterior-posterior length of the maxilla, the mandible is going to go along. It's going to see its part going forward and away, and it will follow. So the growth of the mandible is so intimately connected that you could say that the key to its remodeling and its resizing and its redistribution in the facial skeleton of a kid is actually the maxilla. It's not a treatment plan even aimed at the mandible. The mandible will come along for the ride.